Assalamu alaikum. Let me welcome you on behalf of Ahsan Academy on a presentation on lymphatics of head and neck region. Let us fix the objectives. We'll discuss in this presentation lymphatic arrangement of the head neck region and a specific area drained by each group of lymph nodes, and every stage we will try to correlate the clinical aspect. Lymphatics of the head neck region are present in two sets: a superficial set that lies in the superficial fascia and the deep set that lies deep to the deep fascia. They drain from two different regions. This is the lymphatics of the skull and face and the lymphatics of the neck region, and this will be discussed as per the superficial and deep, and also will be divided in these two regions in subsequent slides. No lymph nodes is present in the scalp. Only the lymphatic vessels are there. They carry the lymph to the distal part from the scalp, and it is present in the face. Two groups are observed. One is the parotid nodes. This is present over the outer surface, means external surface of the parotid, and maybe close to the upper pole in front of the auricle. This group drains the lymphatics from the scalp, auricles, eyelids, and the cheeks. Buccal group of lymph node. This is situated over the cheek and over the muscles, that is vaccinator muscle. There are a few in number, maybe one or two lymph nodes are there. This drains from the forehead regions and anterior part of the face. Four groups of lymph nodes are observed at the junction of the head and the neck. These are the submental nodes. It is situated in the submental triangle in the superficial region just below the chin. And submandibular lymph node, this is the group of submandibular lymph node, lies superficial to the submandibular salivary gland just below the lower margin of the jaw. The retroauricular or the mastoid nodes, a group of nodes that lies behind the ear over the mastoid process. The posteriormost group of lymph nodes is the occipital nodes and situated over the occipital bone. The previously shown figure is enlarged here. You can identify each group of lymph node here on this figure. These two groups, parotid group and buccal groups, are described with the face, lymphatics present in the face. Now, the junction between this head and neck, this area having four groups of lymph nodes. This is occipital group of lymph node that carries lymphs from the posterior part of the scalp and back of the head. This is the mastoid group of lymph nodes. This carries lymph from the scalp as well as auricles. Submandibular group of lymph node. This brings the lymph from, accept the lymph from the face, cheek, nose, upper lip, gum, and the tongue. Is the submental group of lymph node. It carries lymph from the tip of the tongue, lower lip, and nearby chin areas. These four groups are arranged in a linear fashion at the junction in the superficial region. Let me show it by a line, black dotted line. So this is outer ring formed in the superficial area. Let us discuss the inner ring that is formed by a group of lymphoid tissue. These lymphoid tissues are present in the submucosa and association in the nasopharyngeal area as well as oropharyngeal area. These are part of the MELT, means mucosa associated lymphoid tissue. These together makes Welder's ring. In the dorsum of the tongue, the posterior part contains the lingual tonsils, a group of tonsils. Then in the lateral wall, there is palatine tonsils, and in the lateral wall of the nasopharynx, the tubal tonsil. In the posterior superior part of the nasopharynx, this is the pharyngeal tonsil. So this is together making a ring. The pharyngeal tonsil, the tonsil, palatine tonsil, and the lingual tonsils. In the neck, we get the lymph nodes in the superficial arrangement as well as deep arrangements. The superficial arrangements are anterior cervical limbs that lies along the course of the anterojugular vein in front of the neck as shown in the diagram. The superficial cervical nodes that is present along the course of the external jugular vein by the side of the neck. This is also marked in the figure. In the neck, a series of deep grooves are present. Say this is the internal jugular vein. It is remaining group of lymph nodes are observed alongside this vein. The deep cervical nodes, they form the vertical chain along the course of the internal jugular vein within the carotid sheath. Jugulodigastric, this is the jugulodigastric node shown in the diagram, lies below and behind the angle of the mandible. Jugulo-omohyoid, this is a few lymph nodes are there who are very large, and it lies on the omohyoid muscle. Near the viscera, the deep group of lymph nodes are observed. This figure on the right side is showing the pharynx from the back, and the median section is visible on the second figure. So retropharyngeal lymph nodes lie behind the pharynx and in front of the vertebral column. The laryngeal lymph nodes lies in front of the larynx. The third figure from the right showing the larynx, and in front the dots are the position of the laryngeal lymph nodes. Below the larynx there is trachea. So in front of the trachea, group of lymph nodes are there. These are pretracheal lymph nodes. These two diagrams showing the lymphatic flow from the scalp. The scalp is not having any lymph nodes. The capillaries are formed and they unite together to form the lymphatic channels or vessels that carries lymph in all directions and go to the superficial lymph nodes as we have described earlier. This is the parotid groove, retroauricular groove or mastoid groove, occipital groove, and superficial cervical. All limbs receives this. Then from these lymph nodes, the relatively larger vessels carry and drain these limbs to the deeper chain. And finally, inferiorly, a jugular trunk is formed that is shown by round. This jugular trunk is draining, passes further into the root of the neck. This figure is showing the final destination of the lymph. You can see the blue color vein on the left side and on the right side. The two veins, the left and right internal jugular vein, unites with the respective subclavian vein to form the brachiocephalic veins. So left brachiocephalic and right brachiocephalic are formed, who unites together to form the superior vena cava. Now you can see the lymphatic pathway by green color. On the left side, from the abdomen and thorax, a large duct is coming out in the root of the neck, that is thoracic duct. On the left side, it hooks round and open into the jugulo-subclavian junction. This thoracic duct receives the left jugular trunk, what we have discussed in the previous slide, the finally formed large trunk. This opens into the thoracic duct on the left side. On the right side, all the lymphatic channel unites together to form the right lymphatic duct. In this formation of the right lymphatic duct, this right jugular trunk takes part. So right jugular trunk, subclavian trunk, and bronchomediastinal trunk together fuse to form the right lymphatic duct, who opens into the jugulo-subclavian angle of the vein. The lymph nodes are clinically significant because these filters the blood, so whether infection or cancer cells that accumulates in the lymphatic lymph nodes, and it swells up. So we can find out, remembering the anatomical position, the size of the lymph node. If it is enlarged, we can easily palpate that by our finger, or sometimes it becomes so large that can be visible. The superficial lymph nodes are visible through the skin. You can see this is the jugulodigastric node visible here. This one is the submandibular lymph node. You can clearly see it. This one is the deep cervical lymph node, very large, and very wide swelling is formed. Thank you very much for remaining with the presentation.